Of the interventions in place. We're joined by Gauteng Health MEC Nomantu Nkomo-Ralehoko. Thank you so much for your time, MEC. We do appreciate it. I do believe that you are still on the ground, so we thank you for taking time out to speak to us. The situation looks rather worrying. We do know that 10 people have died, including a 3-year-old. 37 people have been admitted. You're on the ground. Tell us how dire the situation is.
It is really dire, my sister, and we're here now, as MMC is saying. We've been here since morning. We're trying to assist where we can so that we can minimize the pressure from the hospital. We have tried some of the patients to the 2 hospitals, which is Steve Biko and George Mukari. But there are those that are still here with us as we are busy trying to assist so that we can put them in, because they can't go home in the condition where they are. So we're taking those that are not critical to the 2 hospitals. The critical ones are with us here so that we can observe them.
So we know of 37 people that have been admitted. Out of those 37, how many are in critical condition?
Almost all of them are in critical conditions, Haida. I have to be honest with you. I will be lying if I say they are not critical. So hence we are worried, and we feel that we're praying that the numbers must not go down. We are with this 10 that we're having now. But what we have done again is to activate our command center. As you know, that we have that center that we have activated previously. So we are going to the communities just to make sure that they drink clean water, and they must boil their water when they are drinking it. And the municipality is assisting us with the trucks that are coming to deliver water in the area.
I want to speak about whether or not, or maybe you can just give us some insight, MEC, about whether or not more people are being admitted, not just at the hospital where you are now, but other hospitals as well. Do you know of that number increasing from 37?
No, not yet. It's only here in Hammanskraal where we have been hit hard, and we are running the test now as we speak. There is a team that is there because we have the awareness drive that we have activated through this command center that we have done between ourselves and the local municipality. And the national government will be coming in tomorrow morning to assist us, but we've been briefing them about the issues, especially on the side of water. The minister and the deputy ministers on water affairs, they will be assisting us. They are coming tomorrow to activate everything on their side. And we want to ensure that we improve our coordination, and we make sure that water that is here, especially these 6 areas that we have identified, which is Kanana, which is Surman, which is Camping, quite a number of those areas, Portion 9 and Skangvater and Greenfield, Carousel View, Surman. Our focus is in those areas where we know that we have these numbers of people that are admitted. 90% but comes from Kanana. Hence, we have made sure that all the teams are at Kanana. During the day, we went even to the churches so that we are able to distribute some pamphlets and send the messages to the church leaders to tell the people to make sure that cholera is here. This area has been hit hard by cholera. But again, we have counselors that we've distributed to all the families that have been affected. So the counselors have been assisting the families in terms of talking to them and normalizing the environment there. And at least there's that little bit of acceptance from the families. I think things will be better because our energies now are here. We're ensuring that things become normal. We're expecting Premier and the Mayor of Tshwane. They are coming. They are going to join us now soon. In the next, at 7 o'clock, they will be with us so that they can see and observe the environment. And after that, I'm sure the Premier will make a statement and indicate what needs to be done after that.
Yeah, it's rather unfortunate, MEC, that you have to now do damage control and really try and inform the community as to what's going on, given that this area has had water problems for a very long time. It's not your department to speak on, but it's very unfortunate that it had to reach this point, and we do hope that no more than 10 people die and that number does not increase. I want to speak about the increasing capacity and resources. You've spoken about Steve Biko and George Mukari Hospital. What else is being done to increase the capacity? Because we don't know how many more people are going to get cholera and how far and wide this outbreak is going to reach.
As I've indicated, we're activating our teams that we work with them at the Command Council. What we have done so far, we have the plans in terms of our war room, and there's a team that is coming from EMS that is coming, and then we've organized again the interns. Our doctors who are interns, they are going to come and assist. All of them are going to clock in at 7 o'clock. And again, there is a ward. There are wards that we've activated from our APT structure. Hence, you saw me with the mask and the gloves. It's because I've been busy. We've been organizing that ward. So it's ready now so that if we have more people, they are here. But we are working again with the universities. They are assisting us and to make sure that everything becomes normal in the environment.
Certainly. I want to ask you what else those that are watching and are in the Hammanskraal area panicking at this stage, do they need to just stay away from tap water? I know you mentioned the fact that they could possibly boil the water. Is that advisable at this stage? What should community members in that area and surrounding areas do at this point?
Part of our preventative measures were to ensure that we have water that is delivered, which we believe that it's proper now, they can drink it. But again, we're still encouraging them to utilize that drinking water, add a little bit of salt in the water so that they can drink that water then or use it. So those are the things that we're doing. But those who are all here, all hands are on the deck, councillors are here with us. Some of the NGOs in the area are working with us. So everybody is very supportive in the area.
You did mention the fact, MEC, that the Premier is on his way. Maybe just tell us what else is being done on the ground. I know you've said that all those 37 people that have been admitted with cholera are almost in a critical condition, but we do know that 95 people from surrounding areas have been seen at the hospital with similar symptoms. You did mention it is a dire situation, but it's worrying that 95 people are showing these symptoms.
What we have done earlier on is the door-to-door that the teams have been doing to each household in the area, in the 6 areas that we've identified. And again, the municipality is busy now checking all these areas where we have illegal dumping so that we're cleaning them. In fact, so that one is happening too. And the councillors are there because all the councillors were here, which we really appreciate. And we've identified teams that must go with the councillors to those specific areas so that we can work in those areas and try to clear all the things that are not right in the area. Social development is here in terms of intervening on the assisting families where they need counseling, as I've indicated earlier on. So all those social workers are in each family serving a social worker, but there are those again that are centrally for those that are coming even from the hospital. Then we have a pool of doctors now that we've pulled and the nurses from the clinics around in the surrounding areas that are assisting as we speak.
MEC, I just want to ask you in terms of when you were informed about this cholera outbreak and when you were informed as Gauteng Health about how dire the situation is.
They informed me it started on Friday evening when they were admitting some of the patients. And then Saturday, we had to send the teams here in the hospital to try and assist and ease up the pressure. So the teams have been here Saturday evening and yesterday, the whole day, including today, the teams have been here. Hence, it was easier for us. The municipality, the MMC has been working here. And even yesterday, she was here with the councillors. They've been here. They left early hours of the morning today. And in the morning at 9 o'clock, again, we're back on site trying to assist all of us.
Okay. Well, we wish you all the best, MEC, and we do hope that the situation is brought under control. Thank you so much for your time, and thank you for all the work that you are doing. That was Gauteng Health MEC, Nomantu Nkomo-Ralehoko. And as you heard the MEC mentioning that the situation is dire, all 37 people that have been hospitalized are in a critical condition. And